with a sense of deep regret and mourning because over 4 months ago, our city lost 2 community members, healthcare workers, Jacqueline Amapokwa, and she was a social worker who very much loved her son and liked to travel. She was 45 years old. And Katie Annette Flowers, 63 years old, a nurse who friends say loved her daughters, grandbabies, and most importantly, Dr. Pepper. Together, the people who are standing behind me today, we send the Pokwa and Flowers families our love and support as they mourn, as we all mourn together, the loss of their loved ones. And I also want to recognize and thank Methodist Dallas Center Sergeant Robert Rangel for his heroic actions in stopping further murders. He bravely shot, disarmed, and prevented the escape of the convicted felon who killed Jackie and Annette. And right after the shooting, there were calls from throughout the city for a top-to-bottom review. Chief Garcia, among the most timely and poignant voices in that effort. So I'm very proud to lock arms with the chief as we really try to analyze what were the last best chances for us to have avoided this tragedy. And as part of this review, our office requested that the state auditor, our independent arm in Austin, review this situation. That independent investigation is ongoing and likely will be released either in late April or May. But in the meantime, since the legislative session was going on, I wanted to work with these elected and appointed leaders at our City Hall and also members of the business community to find the right balance, to hit the right notes and make sure we dealt with this issue in a way that would save future lives. We are offering a suite of bills that are going to make our community safer. They seek to protect community by prohibiting cutting off one's ankle monitor. That's House Bill 3547. It came as a revelation to me and many others in the state legislature. I'm on the House floor regularly, and members are coming up to me and saying, I had no idea it was not already massively illegal to cut off your ankle monitor. So House Bill 3547 recognizes that gap in the legislative infrastructure and makes it so that anybody who cuts off an ankle monitor, regardless of which type, is going to serve not only the rest of their sentence, but also is going to be charged with a state jail felony. Okay? And we think that is the right note to send and will have the right deterrent effect so that people do not cavalierly cut off their ankle monitor as the murderer did in this case. We also want to protect safe havens. Hospitals have to be notified by the Board of Pardons and Paroles when offenders step foot in their buildings. There is no question in my mind, had the Board of Pardons and Paroles, the parole officer, called the chief law enforcement officer at Methodist Hospital and said, you have a violent criminal on your campus, coming to your campus. They are going to be in this room to witness the birth of their child. They would have put eyes on them. They would have patted that person down. There would have been a persistent and constant law enforcement presence around that person to prevent the harm that occurred that day. And we also want to make sure we protect hospital workers. And I've been working with my colleague Julie Johnson from North Dallas, Coppell, and Carrollton on her identical bill. This is House Bill 3548, so that if you assault a hospital worker in a hospital, you're going to be charged with a third-degree felony. Our hospitals need to be safe havens, and our hospital workers need to be protected. The Pokwa and Flowers families have given me their blessing to name House Bill 3547 and House Bill 3548 after Jackie and Katie. And I will tell you that this is an important priority. One of the first questions I always get asked in the legislature is, hey, does this have broad bipartisan support? And what happened at Methodist Dallas was so shocking and so alarming, and the failure so great, that I will tell you I've got Republican House members walking up to me, Democratic House members walking up to me, all asking me to sign on to this bill. So I think there's going to be substantial momentum. On the Senate side, We have Senator Huffman, who's a Republican from Houston, who's working on an ankle monitor bill herself that is virtually identical to the one that we have. And then on the House side, Senator West has agreed to pick up the bills that require that hospitals be notified when you have violent criminals on their campus, and then also the bill related to the assault of healthcare workers. So again, Republicans and Democrats on the House side, Republicans and Democrats on the Senate side. We really want to move this legislation, and candidly, I don't care who gets the credit for it. I want to make sure that it passes so we keep our hospitals and our communities safe.
The bottom line is this, and you've heard me say it before, that it is my belief that ankle monitors do not work for violent criminals, and accountability is minimal for our most violent offenders. Violent offenders who are back out on our streets, sometimes just weeks after being arrested to commit more heinous crimes and terrorize our neighborhoods. Speaking for my community, the men and women of this police department, for the victims, at what point do we recognize we have given enough chances to violent individuals? That time is now. With this bill, it's a start to holding our most violent offenders accountable. As was mentioned, currently in Texas, it's not a crime to cut your ankle monitor off, and only administrative violation. That's not enough. This bill, as was mentioned, will make it a felony to cut off the ankle monitor and require them to serve the rest of their original sentence. What's in place now is not working and has cost lives. It happened here, as we heard. Jackie Pocua and Katie Flowers, the two healthcare workers, were going about their day caring for others when they were senselessly gunned down by Nestor Hernandez. I've stated publicly before the fact Hernandez was back on the streets was a failure of our criminal justice system. With his violent criminal history, assault of a public servant, possession of a controlled substance, aggravated robbery, he should have never been on ankle monitor and should have remained in custody. It takes all of us, police, clergy, city leaders, community leaders, and neighborhoods to fight crime and to keep our city safe. It will take us all working together to get this bill passed and signed into law and further protect our neighborhoods and our city, and subsequently our state. The lack of accountability is costing us lives. It's cost us Jackie, Katie, and others. Also, I will tell you, as Major City Chiefs President, I can assure you that this is not just happening here in Dallas, it's happening nationwide. And it's time we further the work to put a stop to it. This bill is a start to holding our most violent offenders accountable for their actions, and most importantly, a start at saving lives from violent acts.
We really appreciate the support that we've received from the legislature. As was mentioned, this is bipartisan support. As we look at violence in the workplace, what happened on October the 22nd, 2022 was quite tragic. But if you look at surveys throughout America, hospitals every day encounter workplace violence. 68% of nurses last year had some form of verbal abuse. Some even had physical abuse. So we are appreciative of the work and really the community coming together, especially in a bipartisan way, to recognize making hospitals a safe haven. We want a safe haven. When people are there to be treated, when people are there celebrating when they deliver newborn, but also, unfortunately, when they're there for other reasons, maybe trauma. We have to realize that some days emotions run high, but we need a safe place for the patients' families, and of course, the healthcare workers. So on behalf of the hospitals in the United States, in the state of Texas, and here in the DFW area where we represent 90 hospitals, we thank you for the safe haven. We thank you for the bill to deal with ankle monitors, notifications to the hospitals, knowing who is coming, when they're coming, why they're coming, so we can continue to be a safe haven for health and healing.
Events that occurred on October 22nd, 2022 at the Methodist Dallas Medical Center were nothing but tragic. Today, we honor Jacqueline Poqueye and Annette Flowers as we shed light on this terrible situation. As the council member representing Methodist Dallas, it is a privilege to stand here today with my representative, with the city manager, with the chief of police, and with my council colleagues in Methodist to support this important legislation. How many times in this country as leaders do we need to repeat this refrain? Let's do what we can to make sure that this never happens again. The heartbreak should not stop us, but should embolden us to never quit trying. We have an opportunity now with these bills to make real change, not only in the city of Dallas, but throughout the entire state of Texas. We're fortunate to have a police chief and state elected leaders like Rafael Anchía who go above and beyond every day on behalf of our community. And I'm honored to serve alongside both of you. As we move forward, I hope that District 1 and the city of Dallas will continue to be a place where residents, businesses, and communities can thrive and feel safe.
What happened at Methodist was devastating to our community and should never have happened. Our hearts are with the families of Jacqueline Poqueye and Annette Flowers as they navigate through this difficult time. Grief is unforgiving, and we want their families to know that we still are grieving with them. Even as we see overall crime decline in Dallas, every loss is all of our loss, and the safety of our community must come first. And so I know Representative Anchía feels the same. We are grateful to him and to our own police chief, Eddie Garcia, for their leadership and commitment to seeing this through. Thank you, Representative Anchía, for championing this legislation on our behalf and on behalf of our community. We stand with you and with our leaders in Austin. We're behind you, and thanks for the privilege of being with you today.
First, let's give honor to God. It's a blessing to be here this morning. And for 13 years, I have served as the Dallas City Council District 8. Have always been an advocate for keeping our community safe, and I believe that this proposed legislation by Representative Anchía will help us to get closer to doing that. As Chief Garcia highlighted, anyone who tampered with their ankle monitor intentionally hide their whereabouts and misleading. I just kind of thought back that when a person go to jail, he is in jail. If he escaped from jail, he don't commit a crime. And I believe that's a felony. You in jail, you escape, but now you got an ankle monitor.